Your behavioral health outcome measure library is only as useful as the system it lives in. A score buried in a PDF is hard to trend and hard to trust. When a measure disappears into a static file, the number stops being a treatment signal and becomes dead paperwork. Outcome measures give treatment centers a repeatable way to know whether care is helping. Here is how an operator tracks and reports them in software. We cover what an outcome measure is, the common types, where the data should live, and how to make tracking sustainable for your team. An outcome measure is a standardized way to capture change, symptom severity, functioning, risk, satisfaction, or recovery progress. The value is not just that it produces a number, it is that the number can be compared over time. One score at admission tells you where a patient started. A later score tells you whether the current plan is working. Instrument names, raw scores, and interpretation bands belong in the progress note. Under CPT 96-127, that documentation is what makes the assessment billable. The biggest mistake is treating outcome tracking as a compliance exercise only, a separate reporting project that gets rebuilt by hand every quarter. A measure captured in a form that disappears into a PDF is hard to trend, hard to report, and hard to trust. If a measure is clinically useful but too hard to collect reliably, it will not survive contact with the real world. Outcome measures are most valuable when stored in systems that can reuse them. A generic disconnected file can't trend. Behave Health is designed to keep the data connected. In Behave Health, the EHR can hold the clinical record, and the CRM can preserve intake context, so a measure is captured once. The recovery dashboard can surface progress to staff, and the reporting layer builds meaningful views in reports and analytics. Most treatment centers use a mix of measure types rather than relying on a single instrument. Your library should cover 4. Let us walk through all 4 types your outcome measure library should track. Type 1. Symptom measures. These track changes in depression, anxiety, trauma symptoms, substance use severity, or other clinical concerns. They are the most familiar category because they give the clearest before and after view. Type 2. Safety and risk measures. Risk screening helps clinicians identify urgent issues that require closer monitoring or a different level of care. These measures matter because progress is not meaningful if safety is deteriorating. Type 3. Functioning measures. Outcomes are not limited to symptom reduction. Many programs also care about work stability, housing stability, family functioning, school participation, and daily living skills. Type 4. Patient-reported measures. Patient-reported outcomes matter because the patient is often the best source of information about how treatment is going. They also support shared decision-making and help teams spot issues that might not appear in a note. The best measures are the ones your team can use consistently. Start with a few questions before you build the library. What does success look like for this program? And what do clinicians need to know to adjust care? What do payers or accreditors expect to see? How much assessment burden can patients realistically tolerate? And can the data be collected at intake, during care, at discharge, and at follow-up? When outcome measures are collected consistently, treatment centers can use them in several concrete ways. Adjust treatment plans when progress stalls, and identify patients who need more support. Compare progress across programs or clinicians, prepare summary reports for leadership and referral partners, and support measurement-based care and payer conversations. The easiest way to make outcome measurements sustainable is to build it into the normal workflow. Collect measures at predictable intervals and use the same instrument set when possible. Automate the reporting layer so the team does not have to rebuild the story by hand. If your software cannot do that, the problem is the system, not the measure. Behave Health connects the pieces so your outcome measure library is captured once and reused everywhere it is needed. The EHR can hold the clinical record, so instrument names, scores, and bands sit with the patient instead of in a one-off PDF. The CRM is designed to preserve intake context, so admission scores stay connected to the rest of the story. The recovery dashboard can surface progress to patients and staff as scores change over time. The reporting layer is designed to turn that same data into meaningful views in reports and analytics, instead of a project rebuilt every quarter. Stop losing outcome scores to disconnected PDFs. Book a 20-minute demo at behavehealth.com. See an outcome measure library tracked in the EHR and reported in analytics. Book a 20-minute demo at behavehealth.com.